Good afternoon, everyone. I'm delighted that I've got two of our project team with us today. Vinay Patel, who's the founder of PredicAire, and also Callum Stuart, who's a mentor at Codebase. They're going to talk, we're going to have a little chat about their project, what they're doing, and where it's going. So maybe, Callum, you could start by maybe telling me a bit about yourself, about Codebase, and about your involvement with the Healthier Working Lives programme.
Sure. Thanks, John. Pleased to be here. I'm a technical startup founder. I've founded three startup companies so far, originally as a software engineer. The last business I founded ended up with about 1.5 million users on the platform, had about 700 million opinions on clothing products for the retail industry. We had a team of 35 and we'd taken about £6 million worth of investment. And it was kind of like big data analytics for high street clothing retailers. I now work as a mentor. Well, I have a small sort of startup growth consultancy, and I work with Codebase as a mentor for lots of different tech businesses across many different sectors, and really help them understand how to grow their business from a sort of zero to one point of view, if you like. I act as a sort of fractional COO at many points that's sort of my background. So Codebase.
Officer for
Codebase is one of the UK's largest accelerators. It works across the UK through the Barclays Eagle Labs network, but also across Scotland through the TechScaler network, and is really focused on helping tech founders to start up and grow their businesses. And yeah, from the Healthy Working Lives point of view, I'm one of the mentors, so I'm helping this team. So I'm helping them sort of challenge and develop the problem statement and any solutions that might come out the other side of that.
Great. Vinay, could you do likewise? I'll just tell people how we first met, Vinay. So sure. Part of the Healthier Working Lives program, we've been talking to people that we thought were real trailblazers within the care community, people who were doing something innovative, different, maybe not directly in care homes, but you could see how you could pivot what they're doing to take advantage of the situation in care homes. And Vinay was one of the very early people that we spoke to, and it's been great that he's been on the journey with us for quite a long time now. So great that you're part of the ongoing program, Vinay. Tell us a bit about you and about
Sure. Thanks, John, and thank you for having us involved in the Healthy Works program, because I think it helps share our problems. So me, I'm Vinay. I'm a care provider. I have a couple of care homes in Suffolk in England, and I've been running them for 10 years. And through that running an operation of 10 years, me as a provider, I've faced a number of problems, a number of issues regarding operational processes, etc. And having looked at the market about 4 years ago, realized that the single biggest problem was data and how the data was captured by various software, because the nature of the sector is flooded with lots of fragmented solutions, and there wasn't any holistic solution. So along with the other co-founders of PredicAire, we then decided to solve that problem, which is of data and having quality data so that you can apply AI to it. And sadly, I say sadly because we had to then go and create the ecosystem for it. Otherwise, it could have been good to work with the existing software systems out there to make sure that we can deploy the AI solution quicker. But as we have to then capture the data in a specific way, we've deployed PredicAire such that it's a full, holistic, single ecosystem software that looks at the whole of the care operation, not just the care or not just one single department. It's actually looking at it from the lens of a provider. And we've made it so intuitive and interactive that anybody, depending on your role within the organization, can use PredicAire and have your meaningful input. The vision of PredicAire is essentially to bring in better care and better outcomes for every stakeholder in the care chain. So having experienced the problem myself, I think we've approached it with that approach where we've felt the pain and we want to provide a solution which is not just applicable to my own care homes, but actually to the wider community of care homes.
Great. So that's fantastic. Thank you very much. I'm very conscious that, and this was when we spoke to Andy on the last bulletin, that at the stage of the project that you're at the moment, it's very much about defining the problem rather than sweeping in with solutions at too early a stage. Callum, can you just tell us a little bit about that process, some of the things you've learned, and then I'll come back to Vinay to talk about the sort of the lessons that we can learn for the care sector as a whole. But Callum.
Yeah, sure. We were working with Alison Vale from Abbotsford as part of the team, and some of her employees as well. And it was reasonably interesting early on that Alison was aware that they were certainly capturing a lot of the information and data that they needed to capture from a regulatory point of view. And I think, I think there was just a feeling that perhaps we could do more than that, and perhaps that we could start to think about, well, if we're capturing data for regulatory purposes, for proof of care, evidence of care, if you like, could we also use that data in other ways, in better ways, in ways that we can start to think about whether or not there are improvements to care that we can come up with through the use of that data. And perhaps that wasn't necessarily being explored in quite the most depth at the moment. I think care homes clearly are very time poor and struggling, and then we've got systems like Vinay's who are capturing a lot of that data. And I think it's and I think Vinay's already looking at the sort of evolution of that and how he uses AI. But it was really interesting to have that conversation between a care home who are clearly thinking about it and are starting to think about how they would design solutions for it, and also Vinay, who is sort of on that track already, if you like. So yeah, we had to be careful not to solutionize too quickly, and I think we've got to the point where certainly with Alison and Abbotsford, that they see that problem exists and they're starting to think about how we might solve it. We haven't gone down a solution route yet. But I do think there's also an opportunity for us to look sort of across the sector and see, is this a similar feeling across the sector where this data could be used in that sort of way.
Great. So, I mean, Vinay, it's quite interesting because you're in quite a unique position in that you actually run care homes as well. So actually you can straddle the problem. You've got feet in the solution as well as the problem, which is a almost unique position to be in.
Yeah.
I mean, one of the things that we've been really conscious of as we've looked at the projects in this overall program is that what we don't want to do is develop ideas that maybe are just applicable to one care home, but actually looking at understanding problems across the sector, and ultimately then developing solutions that will work across the sector at scale. Tell me a little bit about your feelings about that and why that's important, and how your thinking along those lines is starting to evolve.
Yeah, no, I fully agree with what you've just said. Is the problem that I experience is also a problem that most care providers experience. As Callum alluded to, we have a regulatory obligation to comply by providing written records of the care that we deliver. That there's no prescription whether that should be digital or not digital. It can be on paper. So there's about 50% of the care sector in the UK that are still paper-based, right? But they're still compliant because they're providing their record keeping to the regulator. But the real problem, and if you put an eye on the future, is about that data. Again, I mentioned earlier on, is about the data on paper. Whilst it makes you compliant regulatory-wise, it's not really helping you to deliver better outcomes. And there's a change in the sector right now as we speak, where the regulator is moving from a task-based process towards an outcome-based process. So you will end up having to focus on outcomes rather than tasks. And that's the problem that every provider in the country will be facing, right? And we've designed the solution to be one generally applicable to most care homes in the country. You will have some customization required. And we're constantly taking our clients' ideas. PredicAire has around 45 care homes right now using this, and they are always coming back with feedback, which means we have, as our cohort of clients grow, we'll be able to make the software even more nimble and applicable to a wider community of care homes. But generally speaking, we've got the big heart of it is already captured, where most of the problems that a provider faces in today's speak will be partially resolved with PredicAire. And as PredicAire grows, it will continue to solve those problems. There are different things like, like I said to you earlier on, it's not just the care side of it that's a problem for care homes. Sometimes the finance is a problem for care homes. Getting paid on time is a problem, right? Because we're running a business, it's a fast-paced business. There's lots of different things that are moving around. So finance, we're building a finance module to help solve that problem at the outset, rather than having to wait till somebody hasn't paid you yet, right?
Right. So look, I'm going to apologise for this because we're straying way off the script that I sent you originally. But could we just talk about, and then from both of your perspectives, the use of data? Because I know that from some of our earlier co-design work that we've done with a number of the care homes, there is this nervousness about the influx of data, about how that's, there's a perception that going digital is just going to cause more problems rather than opportunities. And Vinay, I hear exactly what you're saying about how the use of data could potentially provide real solutions. But Callum, this is a problem. This is an area you've dealt with in many different areas other than just care homes. Talk to us a little bit about your experience of how data properly managed, properly integrated, made accessible can actually make a real difference.
I mean, my experience most recently comes from the clothing and retail sector, which is a big old industry, has done things the way it's done them for a very long time. And similarly, there's a lot of, there's a lot of interest in data in that space, but there's also, change is difficult for people. And I think as a provider and a vendor, we had to make we had to do a lot of work to bring data to people in a way that fitted with their own routines and with their own operating practices and the way that they work. So we spent a lot of time deeply understanding the industry in the same way that Vinay has by running the care homes, and saying, actually, we don't want you to change what you're doing here. What we want to do is bring data in at the right point in a way that is actually going to be valuable for you. And it's going to have some sort of actionable insight, something that you can do from that data that helps you make your job easier, remove some of the load, allow you to focus on other things. And I think if you think about data in that way, rather than just a dashboard for somebody which doesn't really tell them anything, you actually want to help them go through that journey of, why do you need this data? Why is it useful? How do we get it into your workflow in the most efficient way? And I remember building a dashboard and actually then scrapping that and saying, right, what we need to give you is a bunch of PDFs, because that's how you use that data.
What's it, Callum?
Sorry,
what's a dashboard?
A dashboard.
What's a dashboard?
So a website, with all of these stats and numbers and figures on it, and people just didn't find that useful. What they found useful in our context at the time was a PDF, a document that they could print out, they could take into the meetings, and they could have a conversation with the rest of their team in that way. So I think it's about bringing that data into the existing processes that are there in a way that is super easy for people to access, understand, and then do something because of that data.
Okay, cool. So Vinay, just and again, I'm very conscious that we're not about providing solutions yet. We're still, I think you with PredicAire are ahead in some ways of looking at things, but this particular project, we're still very much at the problem definition stage. But it'd be interesting, Vinay, just to hear your experience of how do you encourage them to adopt technology and to do things differently from the way they've done it before. What's been your experience in that regard?
Absolutely. There's a few things that are relevant when it comes to convincing somebody that digital is the way forward. One, it's clearly it's going to be a very easy to use software, because there's a big reason why the sector is still 50% paper-based, because the solutions out there, or there's a fear that the solutions out there are not going to be user-friendly enough. And the workforce in the care sector is of a certain demographic where technology is not something that they get to quick, right? So they want something that's easy to use, something that's very easy to train people, because there's also a regular attrition rate in the care sector. People come and go in businesses. So retraining would be a costly affair if that had to be done on a regular basis. So I think a lot of that has a heavy weightage into that. And I think there's also the old saying, if it's not broke, don't fix it, right? So ultimately, people are quite happy with the status quo if it's working for them. So if the change will happen, it will be regular led at some point because, as I said, it's going to be outcome focused from November onwards. But the regulator is also expecting quicker access to data, and the data will be in the format to what literally Callum literally said a few minutes ago, which is around dashboarding, where the CQC portal will have potentially a dashboard for the provider to say what sort of information, what's happening in that care home. And for that to really work, the data needs to be in a structured electronic format. I think what I would say to providers is when you're looking at systems, really spend some time understanding the journey of that software provider, where they're going into, because it's all great seeing what they've done in the past, but actually it's what the future is about, whether they will continue to support development and any personalization that may be required for that particular care home.
Yeah, great. No, I hear exactly what you're saying. I think the technology thing, it can be very scary, but my experience, we had a workshop at the beginning of this year in Edinburgh, and we had a whole bunch of care folk people there, and I asked, and clearly technology was starting to become a bit of a barrier, and I asked them how many of them had used Facebook groups during the pandemic to communicate with staff and patients alike, and they all put their hands up. So if you use something that people understand and are used to, and it works, then actually technology is not the scary thing. So look, that was really interesting. Callum, were you going to say something?
Yeah, I was just going to say, I think once you can get to the point where they see the value, where people see the value in the reason for making that change, it's helpful. And I think there's sometimes a bit of a journey, and that was my experience certainly, is that you have to take them on that journey a little bit, meet them halfway almost, and show them why this change makes sense. And then you can, once they're bought in, they will then start to move towards, okay, it makes sense to just do this online entirely. But you kind of have to go halfway with them and just demonstrate to them the value in doing it in that way, rather than, it's the carrot, not the stick, right?
Yeah. And I think what I'd like to add, John, if I may, just quickly, is the onboarding process of that digital journey is super important.
Yeah.
Because you need to identify your key people within the organization who are going to champion that digital journey. It's easy to say the manager will do it, but actually it's a bit more than the manager. You've got the rest of the team that needs to be onboarded onto that. So we have that unique onboarding process where we get our our clients or prospective clients to go through that with us, and we start implementing that with them, and it's very effective. It's proven to be very effective so far.
Great, super. Well, I have to say, guys, the program sounds, the project sounds fantastic. What could the next few months look like? Callum, maybe.
Yeah, I think the next few months is probably understanding sort of sector-wide where the sector sits on this problem that we've identified with Alison. Clearly, we've spoken to her. She's got 8 care homes, so she has a pretty broad view of the industry herself. But I think just taking that to the other partners that we've got in the HWL project, and maybe sitting down with them and talking a bit about what we've discovered, and just see if we can start to replicate that problem again and again. And then it's thinking about how that fits with what Vinay is working on in his product, and how we can bring those two things together.
Right. So Vinay, here's a big question that we're looking at the problem. There's if we can develop a solution that addresses that problem, think through to 5 years' time. What's the big difference you'll have made?
I think we would have made a huge difference in terms of providing the ultimate beneficiary, the resident, with better care and better opportunities for people to spend time with them. Technology is not just a record keeping tool, but actually it will enhance the delivery of care way forward.
Well, I think that's music to people's ears, because if we talk to the care staff that we've talked to over the time of the project, they all say we joined this industry to look after people, to care for people. The more time we can give them to do that, the better.
Absolutely.
So look, every success, guys. Been lovely talking to you this afternoon, and we'll look forward to it in due course. Thanks very much.
Thanks, John.
Thanks, John.
Caleb.